Hello and welcome to the Coding Corner, Medical Coding Education. Today we are covering the top 2 tricks to pass the CPC. My name is Kristen Robinson. I am a coder, auditor, and educator, and I am the founder, co-owner, and educator for the Coding Corner. And we are talking about process of elimination and time management. The CPC exam is not just about knowing the codes. It's about navigating long scenarios, distractor answers, and time pressure. You have 100 questions in 4 hours, which means you get about 2 minutes per question. That's why strategy matters just as much as knowledge. Today, I'll show you how to move through questions with clarity, confidence, and control. So let's start off with process of elimination. What process of elimination really means is not guessing. It's strategic decision making. Your goal is to remove answers that are impossible, illogical, or inconsistent with the documentation. When you eliminate wrong answers, the right answer becomes obvious, even if the question is long or tricky. Here's the exact method that you will want to use. Read the question stem first. Don't dive into the answers yet. Understand what the question is actually asking. Identify the key details. Look for the procedure performed. The approach, was it open, percutaneous, or laparoscopic? Laterality, so is it the left, the right, or bilateral on the body? The anatomical site, so was it the foot, the eye, the arm? How many procedures were performed? And were there any bundled services? Now look at the answer choices. Start eliminating anything that either uses the wrong approach, uses the wrong anatomical site, includes add-on codes that don't apply, includes bundled services, or doesn't match the documentation. Then narrow down to 2 choices. This is where most students panic, but this is where process of elimination shines. Choose the answer that best matches the documentation. Okay, so time management is actually where many students struggle. Not because they don't know the material, but because they get stuck on a few questions and lose momentum. Your goal is to keep moving. You do not need to answer every question in order. You do not need to finish every question on the first pass. What you do need is to protect your time. First of all, practice makes perfect. Prior to the exam, make sure you know your guidelines. Use your books to your advantage. Add tabs, highlight passages, and underline or make notes that work for you. If you hit the 2-minute mark and you're still unsure, mark it and move on. You can always come back. Your confidence builds, your score builds, and you stay on pace. Here's the method that I teach the Coding Corner students. Pass 1. Answer the easy questions first. If you know it, answer it. If you don't, skip it. Pass 2. Return to the medium difficulty questions. Use process of elimination to narrow them down. And then number 3, tackle the hardest questions last. By this point, you've already secured the majority of your points. This method prevents panic, protects your time, and keeps your score climbing. Skip a question when the scenario is long and you're not sure where to start. You're torn between 2 answers, or you feel you're getting frustrated. or if you've hit the 2-minute mark. Skipping is not failure, it's strategy. When you skip a question, make sure you flag that page. When you return, you'll be calmer, faster, and more focused. Often, the answer becomes obvious once you've warmed up with easier questions. Now let's combine both tricks. These two skills work together beautifully. Process of elimination helps you move faster. Time management keeps you from getting stuck. Together, they help you finish the exam with confidence and with time to spare. Trust your first instinct. It's usually right. Don't overthink. Don't change answers unless you find clear evidence. Keep your pace steady. Use process of elimination on every question, even the ones you think you know. You've prepared for this. You have the knowledge. Now you have the strategy. Now we're going to go over a couple of examples on how to break these down when you're in the test itself. So, the first question is an evaluation and a management service question. So, if you look at the question that it's actually asking, it is asking for what is the correct E&M service to bill. So, the first thing you're going to look at is your multiple choice answers before proceeding to the case to review. So the next thing we want to look at is what can we eliminate? So as you can see in the highlighted section, this is a patient presenting to the hospital for an initial outpatient service. Well, that immediately eliminates answer B. 99204 is a new patient office or outpatient service, which immediately eliminates one of the answers. Now we're going to look at complexity of problems addressed. When you are looking at this case scenario, we see that the patient presents with increasing chest pain and shortness of breath. So the next thing to consider is what is our complexity of problems addressed? And if you're familiar with the medical decision-making table, we are going to get to that soon. The next thing we look at when we're looking at this case is data, which is data to be reviewed or analyzed. And this provider orders a chest x ray and an EKG, and both of them are within normal limits. This is another element on the medical decision making table that we are going to review in just a minute. And then lastly, we would look at risk or risk of morbidity and mortality, which is also on the MDM table. And in this particular example, we see that this provider feels that this is related to the patient's anxiety. He orders a referral to a psychiatrist to rule out the anxiety and is deferring further treatment to that specialist, and he is admitting the patient to be observed for 24 hours before being discharged home. So at this point, you'll want to look at your medical decision-making table. You have 3 elements that we've already discussed: complexity of problems addressed, data to be reviewed and analyzed, and risk of morbidity and mortality of patient management. And in this particular scenario, we have a undiagnosed new problem with uncertain prognosis, whereas the provider is wanting additional workup to get a definitive diagnosis. In our data column, we have 2 ordered tests that were also reviewed. That gives us 2 data points. And then we have the decision to admit for observation overnight, which is decision regarding hospitalization. So in this particular scenario, one of our elements is in the moderate column, one of ours is in the low, and then one of them is in the high. So now we have to decide what is the appropriate level to choose. So if you have one of each, you cannot bring the level all the way down to low, and you can't bring it up to high. Therefore, it would fall to a moderate level of medical decision making. Well, out of A, C, and D, 99221 is an overall low medical decision making. 99223 is an overall high medical decision making. Therefore, letter C, 99222, which is an overall of moderate medical decision making, would be the correct code to choose. Therefore, C is our correct answer. We have a second example here of something that you could see on your test. In this particular question, we are finding out which is the appropriate modifier to append. Our question states, when an MD assists on a case with another MD, what is the correct modifier to append? In this question, what we want to look at is what are our modifiers? Modifier 59 indicates a distinct procedural service. This is used to show a procedure or service with separate and independent from another service provided. Modifier AS is for physician assistants and nurse practitioners who are assisting at surgery. Modifier 62 is when two surgeons of different specialties are performing the surgery as distinct portions of the procedure. And modifier 80 is when a physician serves as an assistant surgeon, fully assisting in the primary surgeon's procedure. So in this particular case, with the example we have, the MD is assisting another MD on a primary case. Therefore, modifier 80 would be the appropriate answer in this scenario. Obviously, we can immediately eliminate modifier 59 as we are not discussing a distinct procedural service. The AS modifier would not apply because we have an MD assisting another MD. And modifier 62 would not apply because it is not two physicians performing separate portions of the case. We can only go based on what the question gives us, not what we could assume is being done. Thank you all so much for attending today's session. I hope that you all enjoyed the walkthrough for tips from Process of Elimination and time management. And remember, mastering the CPC exam isn't about perfection. It's about strategy, confidence, and smart decision making. Use these tools, trust your training, and walk into your exam knowing that you are ready. Keep building your skills and preparing yourself for success. If you enjoyed today's session, please make sure to hit the bell to be notified when we go live or update other videos in the future. If you would like to sign up for our new live CPC course, check us out at www.thecodingcornermce.com. Or if you have additional questions, you can reach out to us at thecodingcornermce@gmail.com.